As many of you may know, climate change is a health crisis and has been called the greatest health threat of the 21st century. Because of the way that climate change impacts the air we breathe, the food we eat, the water we drink, and so many other aspects of our day-to-day lives, climate change affects the health of everyone, everywhere. As we can see here, rising temperatures, more extreme weather, rising sea levels, increased CO2 levels, all resulting from climate change, are leading to degraded air quality, extreme heat events, changes in infectious diseases, increased allergens, water quality impacts, and more. This in turn results in disruptions to our health. We're seeing worsening cardiovascular disease, asthma, heat illness, more unpredictable and more intense impacts of vector and waterborne diseases, malnutrition, trauma, and myriad mental health impacts. However, these impacts are not inevitable, nor are they spread equally across our society. Many factors influence ultimate health impacts, including age, gender, race, ethnicity, education, and so much more. Currently, specific groups, including historically marginalized and socially vulnerable populations, are and may continue to be more disproportionately exposed to and impacted by climate change. Racial and ethnic minorities, as well as low-wealth communities, are far more likely, for example, to live in places where urban heat islands exist and therefore are subject to more impacts from heat. They also breathe more polluted air and are far more likely to experience negative health impacts resulting from that. The evidence is clear that climate change is impacting health across the United States and across the world. It's also impacting the ability of the US healthcare system to respond to the amplified needs of our communities affected by these slow and fast onset climate exposures. Simultaneously, though, our healthcare system is contributing to climate change as well as environmental degradation. Currently, healthcare accounts for nearly 20% of the US GDP and accounts for nearly 8.5% of all US carbon emissions. These emissions occur through many pathways, including basic operations of a health facility, the purchasing of energy for heating and cooling, and our supply chains. Just as an example, in 2018 alone, greenhouse gases and toxic air pollutant emissions from healthcare resulted in the loss of nearly 400,000 disability-adjusted life years. According to the US EPA, the health sector's energy use adds over $600 million in direct health costs and over $5 billion in indirect health costs annually. Our healthcare system has a responsibility to do no harm, and many options exist for health systems to prevent the damages caused by the externalities of their activities, which we know are driving disproportionate impacts on certain vulnerable populations. For example, in practice, comparable health systems can vary by more than a factor of 10 in terms of how much energy they use. So we have many opportunities to not only improve the health of all, but also to reduce the financial costs of care. This transformation will require all of us, communities, educators, patients, health professionals, health leaders, and so many more.